we're going to start tracking cervical mucus. And this part takes practice. Okay. It can be really confusing. It's something that I definitely hear the most complaints about in FCM. But your cervical mucus or your vaginal discharge, it changes with your hormones. And this is a really big thing for us to figure out when you're ovulating. And I will never, ever, and this is something we don't learn about in health class. I will never forget a 20-year-old client of mine way back in the day came into my office. She just came off birth control. She'd been on birth control for like 7 years already. And she was like, Kelsey, I keep getting these freaking yeast infections. And I was like, tell me more. She's like, it's not itchy or anything, but I keep getting this white discharge and I keep getting it over and over and over again, like right before and after my period. And I keep using Canestin and it's not going away. And I'm like, okay, describe the discharge to me. And I was like, sweetie, that's normal. That's totally normal. There's nothing wrong. Your body is actually doing exactly what it's supposed to do. We spent the whole hour teaching her about cervical fluid and her mind was like, because we don't talk about it. We don't talk about vaginal discharge with our friends. Maybe we should, but we don't. So we don't really know what's normal. And if you're new to the fertility game and you're just coming off of birth control, this might be very normal for you because you probably didn't get many fluctuations. But let's look at the hormone cycle, okay? This is what happens cycle to cycle. I'm looking over here because that's where my chart is. This is a 28-day cycle that is either lengthened or shortened for you. You do not need to have a 28-day cycle to get pregnant. So this is a 28-day cycle showing ovulation at day 14. The first half of our phase of our cycle is the follicular phase. We start with our menstrual phase and then we're in our follicular phase. During our follicular phase, our estrogen is our dominant hormone. It's rising, rising, rising. It hits a peak and it drops. When it drops, it triggers the pituitary to surge your LH. LH is luteinizing hormone. LH is the hormone that ruptures the follicle. It opens the shell of the egg to let the egg out. It is also the hormone that OPKs, ovulation predictor kits, this is what they're testing in your urine. You'll notice that I have not mentioned those as a thing to track your cycle. We'll talk more about that in a second, okay? Your LH surges, it's the surge in LH that triggers ovulation. After your body ovulates, progesterone becomes your dominant hormone in your luteal phase. This is also your 2-week wait. Your progesterone rises, it peaks hopefully around 7 days post-ovulation, and it slowly starts to fall. If there is an egg that has been fertilized that is embedded into the endometrium, your body will start to produce beta HCG, that's the pregnancy hormone, and it will tell the corpus luteum, keep making progesterone. If that doesn't happen, progesterone falls and falls and falls. It's that final drop in progesterone that triggers a bleed. We get a small surge of estrogen in our luteal phase, but we still have a dominance of progesterone, and that is the balance in which we want. Other things in this chart, just because we're here, estrogen rising, it's thickening the lining prior to ovulation. Progesterone continues the thickening of that lining. Your basal body temperature is what we're going to talk about next. After ovulation, progesterone is being produced. Progesterone is warm. We see a slight increase in our resting body temperature, and that is how we confirm ovulation. As the follicle grows and matures, you'll see up at the top, after it ruptures, it becomes something called the corpus luteum. This is what's making progesterone. If you don't ovulate, or if you haven't ovulated and you checked your progesterone and it's really low, it's not a progesterone problem. You haven't ovulated. That's the problem. Okay? When we're talking about cervical fluid, It's the change in estrogen that changes our cervical fluid. So at the beginning of the cycle, we might not have a lot of cervical fluid. We might have, we stop bleeding. We maybe have some like thick, cloudy sort of discharge. A lot of that's still just like some sloughing of cells. It then will transition into maybe nothing, or into like a thicker white sort of like lotiony texture. As your estrogen rises, that cervical fluid becomes thinner and thinner, and then will become clear, very, very stretchy. And that is what we want to see right before ovulation. That clear, stretchy discharge, it looks like raw egg whites. We call it egg white cervical mucus. And it is what actually helps the sperm survive in the vaginal canal. The vaginal canal is very acidic. Sperm is very basic. This fluid that our cervix produces when estrogen is high, so right before ovulation, is allowing the sperm to travel and survive to get into the uterus and be ready when the egg is already released. So if we're not seeing or feeling that raw egg white cervical fluid, this might be a sign that we need to look into. All right. When I say feeling, I mean, think of vaginal sensation as being more wet and slippery. You might not see globs and globs of raw egg whites coming out of you. That's fine. That is totally fine. But you might notice when you wipe, it's a bit slippery. If you were to put the paper or the paper towel, please don't wipe with paper towel, toilet paper together, you might actually see some strings, or you might be someone that's like, oh yeah, that's raw egg whites, I see it. But there's nothing wrong with having like a smaller amount. I find most women, talk about having an abundance and not about having like just a normal average amount, but we're supposed to see that right before ovulation. After ovulation, again, you might not have any cervical fluid. It might go back to being that more like white, thick texture. You might get a little bit more raw egg white when you have your slight estrogen surge in the 2-week wait. That's all well within normal.